Hi there, I'm come here for flu shot for my daughter.
It may be one of the most dreaded times of the year.
It's just right in here, yeah.
The annual flu shot.
I just need one of her arms exposed for the shot.
We're at a pediatric flu clinic in Toronto, and there's going to be a lot of screaming, but we'll try to keep it to a minimum.
Just gonna have her sitting on your lap.
Yeah.
Already, 4-year-old Noura Anjuman isn't liking this one bit.
I'm scared.
It's not Noura's first flu shot, but the experience is no less stressful. Before Noura knows it, it's over.
That was quick.
That was quick.
It's episodes like this that's fascinated York University's professor Rebecca Pillai-Riddell for some time now.
I think what goes on.
She's following more than 500 parents and their preschoolers during their vaccinations.
One of the main things that we want to always communicate is how powerful parents are. What we found was that parents who were sensitive, parents who knew how to soothe their babies close, that actually carried through all the way to preschool, and we could predict which children would cope better or experience more pain after a needle from how they were acting when the baby was 12 months old.
The research found that kids who were distressed before getting the shot feel more pain afterwards. That's why preparing them before the vaccination is critical.
You're gonna count to 10 with me?
1,
We're gonna clean first.
4, 5, 6, 7, 8.
All right, ready, bud? 3, 2, 1. Alright, it's all done.
Do you have some kind of strategy before you get here?
Usually I tell them a day before to get them ready. And then once we get here, we just count to 10, and then it goes really quick.
Distracting kids during the vaccination is a good thing, say the researchers.
Yeah, look at mommy. Oops. Oops.
Encouraging the child to take deep breaths also helps. But here's a big no-no.
So apologizing to the child, I'm so sorry you're going through this. Oh, mommy is so sorry. I wish mommy could take this needle for you. So that actually also makes a child aroused and worried about the situation.
Does it hurt?
The York University research team hopes to keep following the kids right up until they're 10 years old. Cass Rusi, CBC News, Toronto.
And Dr. Danielle Martin is a physician with Women's College Hospital in Toronto. You have, over the years, given shots to a lot of kids of different ages. Well, what's some of your advice?
Well, nobody of any age really enjoys getting a shot. That's the first thing. So we should acknowledge that it's not a lot of fun, but there are lots of things that we can do to reduce the pain from immunization. In small infants, we know, for example, that breastfeeding a baby while giving an immunization is an effective way of reducing pain. There are ointments and creams that can be applied that are like a local anesthetic in kids of not teeny tiny babies, but older children for sure. Distraction works, and not just distraction like having a conversation or watching a video or Dora the Explorer or whatever, although that can be effective too, but also physical distraction. So massaging the area with a moderate pressure just prior to and during giving the actual shot will distract the body's pain sensory mechanisms. So there are lots of different ways that we can try to reduce the pain from immunization. And then, of course, as we've learned today, there are behavioral things that as parents we also have to watch about what we're telegraphing to our kids about how big a deal it is to get a shot.
You know, when we talked about this in the newsroom earlier today, though, some of the parents, especially whose kids are a bit older now, kind of shook their head and say, you know what, we're coddling our kids. Just give them the shot and get over with it. But you actually feel that we should take a little time.
I mean, I think there are small things we can do, right? So I don't think we need to turn it into a huge deal. But at the same time, it is uncomfortable. And so if we can minimize that or make it easier on people, there's no reason not to. Studies like this actually point to the fact that there's a fine line between you're walking between wanting to not coddle your kid and at the same time acknowledging that something that's painful is painful and it's not fun.
We have just a few seconds left, but I guess we should point out that kids, what you were saying, as young as 6 months old should be getting the flu shot.
That's right. So we're heading into flu season and we know that there are priority groups. There is a significant risk of being hospitalized and having complications from influenza if you fall into one of those priority groups. I think a lot of Canadians know that seniors over 65 or people in long-term care facilities should really have the flu flu shot, but so should pregnant women, and so should children under the age of 5. I mean, we all should, but those are high priority groups, and it can significantly reduce the risk of being hospitalized. And so it is important. And in many provinces in Canada, in addition to the traditional flu shot with the needle, there is also a nasal spray flu shot, so it's possible in some places to avoid the needle altogether.
All right, Dr. Martin, thank you.
Thank you.
So there is a compelling case for the flu vaccination, but it doesn't mean that it's leading to action. Figures from 2015-16 show that overall 32%, just under a third of Canadians 12 and older, reported receiving a flu shot. And it's interesting when you break it down by age. 60% of seniors say they got vaccinated, but those aged 18 to 34 had the lowest rate, just 19%, essentially 1 in 5 getting the shot.